have loss of consciousness. So mild is they may not even have loss of consciousness. So that's what a lot of people feel like, well, I didn't pass out, so I probably don't have a concussion. But that's not true. There's other things that we look at that go into that. So mild is they can have anywhere between 0 minutes of loss of consciousness up to 20 minutes. And then they probably have some disorientation, some confusion, some memory loss. So they may not remember what exactly happened. Even if they don't lose consciousness, they become so confused that they don't remember what happened for the accident. They may not even remember what happened a few minutes before the accident. And that's fairly normal. Nausea, headache, increasing lethargy, so just becoming more sleepy. They can have that as well. Moderate is they have loss of consciousness from 20 minutes, lasting 20 minutes to 6 hours. So this is all according to the CDC. So they will also have all of those same symptoms, or possibly all of those same symptoms that they had during the mild trauma, but they may also start seeing some changes on imaging. So when we do CAT scans or MRIs, we may start seeing either some bleeds in there, like subdural hemorrhages or subarachnoid hemorrhages are the two most common that we would see. So those we might be able to start seeing on imaging. And then severe is somebody that's coming in, back to moderate. This person is going to be probably a little bit more lethargic. So the mild person, we're going to walk in and they're probably going to be awake and talking to us. The lethargic person, the moderate classification, we walk in and they're probably asleep or their eyes are closed, and they won't open their eyes unless we actually touch them or talk to them. And then they'll open their eyes, they'll talk to us, they may answer appropriately or not. And then as soon as you stop talking to them, they usually fall back asleep. So that's what we consider lethargic. Then severe, you walk in, the person is asleep or unresponsive. Even walking over, putting your hand on them, touching them, that's not going to wake them up. Because they're pretty much in a coma is what it equates to. So you're definitely going to be seeing signs on your imaging. So like CT scans and MRIs, you're going to be seeing changes on those. You're probably going to be seeing kind of the midline of the brain. The swelling is going to be pushing from one side to another, and that's what's causing their loss of consciousness. So types of TBIs. This is... concussion is kind of a blanket statement that people use for what they think happens when they lose consciousness, when they get their head hit, or if they're playing football, or if they're in a motor vehicle accident, or somebody hits them with a bat, or some type of injury to the head. But concussion is more towards the mild aspect. So you hit your head, you don't really lose consciousness, or you lose consciousness just for that short period of time, less than 20 seconds. That's usually more of a concussion because concussion doesn't cause permanent brain damage. So that's what you're looking at with concussion. Contusion is kind of the bruising or the bleeding. Those are the hemorrhages that we talk about. Those usually come from a coup contra coup injury, which just means that you move your head forward, the brain hits first here, which is the coup, and then it bounces back and it hits again on the secondary injury, which is the contra coup injury. So you have two injuries going on. Diffuse axonal injury, which is actually what describes shaken baby syndrome. So the baby's usually holding and person's doing this, and the baby's head is constantly doing this, or even off to the side. It's a lot of shearing forces to the brain, so it's pulling on those axonal nerves, and it just kind of tears everything, and it causes a lot more injury than just a regular traumatic brain injury. And then, of course, penetrating injuries, which would be shotgun wounds, stabbing, axes, somebody working on farm equipment and something falls and actually penetrates their head. I've seen that happen. So there's a lot of that. Johnny Beam asked the last time that we did this that we would put some comics in because he wanted some more laughing. So these are for him, and he's not here today. So the lights went out due to a power surge, and the football player says, "Thank goodness, I thought I was having another concussion." So...
Go back. I was going to take a picture for Johnny.
Yeah.
Oh, good idea.
You know, and a lot of the studies and stuff started being done because of the NFL players and boxing as well. Muhammad Ali was another one that had some issues, and we'll get into more of that, of the continuous beating to the brain and it getting injured prior to having that first injury being healed. So. Yeah. So signs and symptoms of traumatic brain injury. So loss of consciousness is one of them. Now you could have all of these, you could have one of these, so it just doesn't matter. Everybody is different. Every brain is different. Every injury is different. So it just kind of depends. But these are things that you could possibly see that we look for when you come into the emergency room or into the clinic if you've waited a couple of days. So, we'll ask, did you have any loss of consciousness? Any confusion or disorientation? So again, when you go in and you start talking to them just about normal everyday stuff, they possibly could seem like they're normal and they're not having trouble with confusion or memory loss. So it's asking very pointed questions and asking them to remember things, date of birth, their name, where they live, phone number, different things like that, date, who's president, that kind of thing. Fatigue. We have pretty much worn ourselves out because the brain has so much injury, so the body's really trying to fix that brain. So they're going to have a lot of fatigue and not want to feel like getting up and doing anything. Headaches, visual problems, so people could have blurry vision, they could feel like they're having spots in their vision. These things can come and go as well. So it's not just that first 24 hours that they'll have some of these symptoms, it's an ongoing thing. Poor attention or concentration. This is something that I think is huge, especially for long-term brain injury patients. I've had several who have come in over my years of working that have had traumatic brain injuries, and this and the fatigue is one of their main problems, and that makes it so that they can't keep a job because they can't focus on anything for any length of time, and there's not really any medication to help with this type of loss of concentration. So it's really a big thing. Sleep disturbances, they have a lot of difficulty with sleeping, especially if it is truly a traumatic brain injury because they are reliving that trauma. So they have a lot of nightmares, and then their body, their wake-sleep cycle is off. That's all of that originates in the brain. So that's going to be kind of injured in this process. Dizziness, loss of balance, irritability, emotional disturbances, that's another one that I think family has a hard time with as well with traumatic brain injuries because they, especially the long term, the ones that have permanent damage, because they do have behavioral changes. Most of them, when you talk to the family, they'll say, this is not the same person that they were prior to the injury because it affects, the frontal lobe has all of the behavioral, emotional, thinking function. So if there's any kind of injury to the frontal lobe at all, then you're going to have some problems with this, which then leads to feelings of depression because everybody's reacting differently to them. And then also loss. They're not able to do some of the things that they used to do. Seizures is another thing that's very common after brain injuries. So you'll see a lot of brain injury patients on anti-seizure medications for a while after their initial injury. And then they also can be bothered by light or noise. So we think of like migraine people having trouble with like being sensitive to light, but it's also brain injury people, sensitivity to light, sensitivity to noise. And some of those things can actually cause the seizures then too if they have that. Dangerous signs of traumatic brain injury. So these are the things that, like if you bring a loved one in or a friend in and they've had a concussion or traumatic brain injury and we allow them to go home with you, these are the things that we're going to say, if these happen, you need to bring them back immediately because it usually means that something else is happening. So somebody comes in and they haven't lost consciousness, or if they've lost consciousness and they've regained it within a few minutes, they still have time. It's usually that first 24 hours is when things are going to occur. I think it was John Travolta's son who had like a brain injury, like seizures, and it was they waited, I think, to take him in. I think that was him. I was trying to remember. There was one of them. They waited to take him in, and he ended up having like more problems from having a brain injury from that. So that's the thing. Waiting is not a good thing when it comes to the brain, and it's bring them in, let's look at them, and if we don't think there's anything going on, we'll let you know. If we do, then we'll move on to something. But definitely things to look for. One pupil, so the dark part of your eye, if one pupil's larger than the other, that's not a good thing. That usually means that there's a lot of pressure on one side and pushing on that optic nerve, not allowing those nerves to be able to kind of constrict down that eye. Drowsiness or inability to wake up. Headache that gets worse and doesn't go away. So usually what I tell people is, if you get a headache, take some Tylenol. If the headache's not going away with the Tylenol, you need to come back in. So Slurred speech, weakness, numbness, decreased coordination. So especially with kids, one way is, if they're normally walkers, if they're already up and walking, if they get up and they start walking and they're going towards the wall, usually something's not right. So bring them back in. A lot of times they're not able to tell you, I don't feel right, I feel dizzy, they aren't able to verbalize that. Repeated vomiting or nausea. Usually we say, okay, if you vomit once, not a big deal, but if you vomit more than that after a brain injury, you need to come back in, because increased pressure to the brain because of swelling is going to cause more nausea and vomiting. So we want you to come back in. Convulsions, seizures, shaking or twitching. So it's not that they have to have a true seizure where they're doing the whole jerking of everything. It could be even just little twitching. We want you to bring them back in because there's something not right going on. Unusual behavior, increased confusion, restlessness, agitation. Those are other things. Loss of consciousness. So say you've taken them home and they lose consciousness again, you need to bring them back in so we can take a look at them again. For infants and toddlers, if they will not stop crying, usually infant or toddler, if something's happened or they've gotten injured or they hurt, mom and dad can pick them up and they can console them. Or you give them a toy and that usually can console them. If you cannot console them, something's not right, you need to bring them back in. Those are other things. Not wanting to nurse or eat. Those are other things that we look for, different symptoms that we look for, that we want you to definitely bring them back in and let us know that something's not right. If you have a traumatic brain injury, long term, then this can actually contribute to seizures, more fatigue, headaches, cognitive decline. It actually can increase your chances of getting Parkinson's disease and dementia as well. So this is another reason for trying to prevent traumatic brain injuries as much as we can. There was even a study that showed that it actually could lead to endocrine problems, so increasing your chance of thyroid issues, diabetes, those types of things too. But I could only find the one study that supported that, so I didn't really put it on there. This is second impact syndrome, chronic traumatic encephalopathy. This is what most of the NFL players have, most of the boxers have, and this was another comic for Johnny. But a person sustains a second traumatic brain injury before the first traumatic brain injury has had a chance to completely heal. So this is where the heads up treatment from CDC is coming in, is so that we can hold these kids out until they have no more symptoms of having a concussion or traumatic brain injury before they go back. So we know that their brain is functioning appropriately and it's healed completely. Because if you have a second injury before that first one is healed, then it actually is a worse brain injury than it would have if your brain was healed first. Does that make sense? So, it's kind of, this person is being asked, you've absorbed many punches in your boxing career. Have you suffered permanent damage? And he asks, can you repeat the question? So he does several times. And the guy says, I'm going to assume your answer is yes. Is that okay? So, all right. So causes of traumatic brain injury. Falls. It used to be motor vehicle accidents and diving. Those were the two number one causes of traumatic brain injuries. However, due to the seatbelt laws and the airbags in the cars, that has actually declined, which is great. So if you have a car that has been in an accident and your airbag has been deployed, you have to have it fixed in order for it to be able to work again. I've had some people who have not known that, so I always try to tell people, go get it fixed, because it's not going to deploy again if you don't go get it fixed. So falls is now the number one reason for traumatic brain injuries, and especially in ages 0 to 4 and above 65. And Frank will talk about some prevention methods to try to kind of help with that. Kids, sometimes there's not a lot we can do. They walk, they trip, they fall. Usually we say if it's from a standing height that they fall, then usually it's not a big deal. Anything greater than 6 foot, though, for kids, for toddlers 4 and under, that's an issue, and you need to bring them in. Let us take a look at them, even if they seem like they're okay for a while. So adults, it's usually 12 feet or 2 stories. That's usually where we're really concerned. We want you to come in and be seen. I had a patient in Concordia who fell. He was actually roofing his own roof. He was an EMT, and he fell off the scaffolding, which was less than 12 feet, but he hit just right that he it ended up with a skull fracture, as well as, of course, then a penetrating brain injury. And when we brought him, when the EMTs brought him in, he kept telling me, I'm fine, just put me in the hospital for a day and I'll be fine tomorrow. And I'm like, no. So, you can tell just by looking at his face, but of course we do the CT scan and stuff, and he ended up having to go and have surgery and everything. And but it's just that, I'm fine, I'm good. I know I'm fine, just take me. But nope, not happening. So, but falls, major. Motor vehicle accidents, farm accidents, tractor turnovers, and runovers are the two major reasons for farm accidents causing traumatic brain injury. So Frank's going to talk a little bit about some rollover prevention structures. They're kind of like roll cages for tractors that can be put on, especially to the older tractors. Sports and recreation injuries, shaken baby syndrome, so abusive head injuries. This even goes into like domestic violence for being hit in the head by your partner, spouse, girlfriend, boyfriend, that kind of thing. Gunshot wounds, of course, workplace injuries, child abuse, military actions, so blast injuries. Anybody who is around like the IEDs and those go off, even though you may not be directly right by it, it's still a blast that's huge and it's going to send you back. You're going to end up hitting your head. You also could have penetrating injuries from that too, because of all the things that they put in the IEDs that come out and can impale you. And then assaults. I wanted to talk specifically Atvs and Utvs. So UTV is what's that?
Get all kinds of different.
Right, the universal. Yeah. I think it's universal. Yeah. So all terrain, universal terrain. So a lot of times kids love to ride these. They want to be out there and they want to ride because it's fun. I would love to. I've never been allowed to have one because of that reason. So, and a lot of times we don't put helmets on them because we don't wear helmets, and there really isn't a law that says we have to put helmets on them. And helmets, I'll say right off the top, are not going to keep you from getting a concussion sometimes, but it will help lessen the impact. So they're huge. Nearly 75% of all ATV crashes result in debilitating brain and spinal cord injuries, 75% of all accidents from an ATV. That's huge. The total number of ATV injuries reported each year has tripled since 1992, and this is all from 2016 data. Riding ATVs is in the same category as football and diving as being one of the leading causes of traumatic brain injury. That's huge if you think about, kids that are out playing football. We put helmets on them, we put pads on them. This is in the same category, riding an ATV. Of the 2,865 ATV-related fatalities, so deaths of children younger than 16 of age, 43% were younger than 12 years of age. So I think we just really need to pay attention to our kids, and when we're putting them on the ATVs, even though we may not feel that we need to put a helmet on, they need to have a helmet on. So we need to be kind of doing a lot more prevention so that we can lessen the amount of injuries to our children. So, all right. Non-traumatic causes. So, this is mainly about traumatic brain injury today, but there are non-traumatic causes for brain injury. So this is just kind of a list of them. Drug overdoses, strokes would be considered a non-traumatic brain injury, so you're going to see changes in them as well. Infectious diseases, meningitis, encephalitis, those are things that they'll come in with some changes to their level of consciousness. So just so you guys are aware of that. And then I'm going to turn it over to Frank so he can talk about prevention.
All right, so we're talking a little bit about prevention, but just to kind of back up a little bit. So, of course, I work in the rehabilitation department with physical therapists, speech therapists. I myself is an occupational therapist. So where do we get involved in the scheme of things? As Robin talked about the classifications of TBI and what that looks like. Well, most of the time that's going to change on a fairly regular basis with that patient. So where do we come in is afterwards. So we're not working with people with concussions normally. But as far as more moderate to severe brain injuries and the aftermath of what the patient is having to deal with, we're definitely right in there, assessing that person for the problems. And think about it. What does the brain do? Well, it's your command and control center. So the short answer, everything. Okay. So it's going to control your muscles. It's going to, everything that you do as far as your mental skills, decision making, memory, problem solving, everything. So it's important to know when the person's recovering what they're having, what are their struggles, and what can we do about it. So, of course, the greater the damage, the more devastating the consequences, right? That's not hard to imagine. But physical problems, yes. Certainly cognitive problems, absolutely. So a lot of these patients go to inpatient rehab centers, and a lot because they're trying to recover from these injuries and holistically, right? Their mind and their body. And a lot of them can't be left alone or even maybe too much care for someone to care for at home. So safety is a big thing. I mean, once you've had one injury, you are much more likely to sustain another one. So prevention, not only of the primary injury, but as Robin said, as any other secondary injury. We don't want them to get hurt again, right? We want them to heal. So just kind of speaking to that a little bit, we're going to talk about prevention, but keep in mind these consequences for severe brain injuries are lifelong, and really essentially boils down to they could have to have somebody care for them 24 hours the rest of their life. So again, big spectrum from mild to severe. So let's talk about helmets, riding a bike, motorcycle, skateboard, and all-terrain vehicle. And just to add on to what Robin said about the kids and the ages are riding these ATVs, UTVs, I mean, should kids around that age be riding them? Is a question I have. Is that a good practice? Point number 2, never drive under the influence of alcohol or drugs. We were always taught in school and even in the field that anybody that had a brain injury where they were using alcohol or drugs was generally not going to do very well afterwards. So it did seem to have an impact on their course going forward in the recovery. Always use your seatbelt and ensure that children are secured in the appropriate child safety restraints. So there's a big spectrum on child safety seats and how they're used and when you have to switch them out and turn them. And so that's always important, I think, to be up to date on. Tractors and rollover protective structures, and seat belts. We have to be concerned, being an agriculture area, about our farm safety. And, just to tell you the seriousness of how really important that is, I just see a lot of fatalities with rollover accidents and tractors. Just as many fatalities as I see brain injuries. So I think, we need to be super worried about kids and young people and even our adults, as far as not taking chances on rolling these big pieces of equipment over. You can have protective structures, but let's be honest, these are thousands of pounds of vehicles, and there's just not a lot of protection there. And even though there is things that you can do, just overall safety regarding using these big pieces of equipment is awfully important. So I would have to say that you could probably statistically narrow down who's more susceptible to people getting a brain injury. Is it young people or older people or people in between? What would you guys say? So
each end, both.
Yeah, okay, good. So the spectrum, we're probably going to see more younger people and more older people because nowadays, and one of the things that's really changed is we don't see a lot of people that have strokes. In my business, when I first started working, we saw a lot of people, and we're working with them on stroke recovery. And we don't see that or bad heart attacks quite as much. So the medicine has improved, and people are on a lot of anticoagulation medicines to prevent clots so they don't get a stroke or a heart attack. But if those same people fall, what's going to happen? those vessels, when they break, are going to do what? They're going to bleed. And that bleeding is going to be more extensive because they are on that anticoagulation program. So, that being said, we do take falls in the elderly very seriously and talk about preventing them. And one of the concepts in with that is called aging in place. So aging in place is basically that no matter if you're getting older or your body's changing, that you've got your environment as such that it doesn't matter, that you basically planned and got everything structured in your house or your home to really fit your needs as your body changes and as you age. So aging in place, it's a nice little sentence to kind of catchphrase to really talk about that. So a lot of times, in what I do is to go out and do some home assessment. So how does a person, how does their abilities match their environment? Okay? So we look at their abilities and see what they can do, but also, is that a match for their environment they're currently living in? Does that environment need to be modified? Is that environment cluttered? Okay? If that person's using an assistive device like a walker or a cane, we just recommend that you have several feet on either side of your walkways as you're moving through the house. Okay? So, equipment. What equipment might you need? You need to modify your shower around your bathroom stool. We're kind of experts on what does that equipment do and what it doesn't do for you. So is the presence of a grab bar in a tub shower going to lift your leg over the side of the tub? No. What's it going to do? It's going to steady you, though. It's going to help steady you, but it's not going to lift your leg over the side of the tub. So if your main problem is you can't lift your leg over the side of the tub, we need to deal with that, and not assume that just slapping up a grab bar is the answer. Okay, and there's really a lot of science behind where should those grab bars be located. So as we're moving in and out of places, in and out of a tub, up and down out of your chair, in and out of bed, we call that a transition. So when we go in and rehab folks are looking at that, we're looking at how that person makes transitions. How do they make that process work, getting in and out of the tub, getting on and off the stool. And we look for things like, I always look for laboring, okay? In other words, is that person struggling to do this? Because if they are, we probably need to change that right now, okay? Because it may not get any better, or on a bad day, I want whatever system you're using to work perfectly, right? So to prevent falls or anything else, accidents from happening. What are some areas you think are high-risk areas in your home of getting a worse injury when you fall? Stairs. Yep. Where else?
Throw rugs in the kitchen.
Kitchen. Where else? Where's there a lot of porcelain? Bathroom? Okay. So, I like all those answers. So steps in the house, outside the house, that's a transition, right, as you're coming into the house. And of course, there's nothing better as far as aging in place that can beat zero entry. So no stairs to get in the house, no step overs to get in the shower, zero entry is probably the best as far as safety, as far as transitions moving in and out of the house, or even inside the house. So risk factors, and that's what we're doing when we were looking at all this, is try to mitigate the risk factors. Poor lighting can be a risk factor for falls. Lack of proper space, which I referred to earlier. Poor body mechanics. So what about, what would you say is it unsafe to try to get things out of your cabinets and have to do this way over here like this, or reach up here on your tiptoes, or get on a step stool? Probably yes. Everybody's shaking their head, right? Okay. So trying to think about reorganization of your items. So I always say you use about 20% of what you have in the kitchen. So let's get that 20% where you can get to it easily. Okay? So a lot of folks, you go into their houses, you open up their cabinets, they got 25 coffee cups or, 30 plates. And I'm like, well, you must really entertain a lot. You must have a lot of company. No. Okay. Well, let's do something about this. Let's trim this list down a little bit. And let's look at the cabinet space that you have. And I always call that first shelf, that $1 million shelf, that $1 million cabinet space right there. If that's what you can get to easily, we better have the stuff that you really need on that shelf, okay? And same way with bending over and getting into low cabinets. Really easy way to fall. Really easy to hurt your back like that, okay? So I remember going to a patient's house and I think she finally got tired of me. She says, "Isn't your wife expecting you home? Shouldn't you be leaving?" Yeah, probably should. Okay, so, yeah. Okay, so another thing, going down another point here is preventing falls by working on your skills, okay? So physical therapy has a great program called Stepping On, and it is a class that works on balance exercises and safety skills. And it's something I highly recommend for people as a preventative measure for falls, okay? So I have a handout. If you need a copy of that, I'd be glad to provide it for you. Going down the list, storing firearms and locked cabinets and bullets in a separate location. I think it's, we all see stories in the news about these firearm accidents with children and whatnot. So I really would encourage going maximum safety and going overboard if we have to, as far as access to these items. Wearing protective headgear while playing sports. And then I think Robin's got some information on the quality of headgear and the options available and trying to find out what helmet would work for you, that there's apps and different things that weren't available before. So, so we talked a lot about those things. What's probably the age group that has trouble making good decisions? Younger males or older males, older adults? Younger males. So statistically speaking, younger males, much higher incidence of brain injury. So that's the group, though, that as they're recovering, a brain injury is not going to make that any better, okay? So younger males, risk takers, getting a brain injury, and now they have that on top of their tendency to take chances and have poor safety. Can you see the problem here? We just made a bad problem worse. So that's why prevention is a big deal, because it's hard for someone who has that trouble already to think they're going to be better at that when they recover from this injury. So I hope that was some useful information. Thank you.
And there is an app, and I'll show you guys that app. I was pretty excited to find it actually myself. This is that rollover protective structure. I had no clue that this was out there, that you could actually add it to older tractors. It's $1,000 to $2,000 to have that added, but it just helps prevent that from being able to come and completely crush that person into the ground. It's kind of like a rollover cage. So this is the app that I found, and it's in the App Store for Android or Apple or whatever you have. You can download it. It's just Heads Up Concussion by the CDC. And it's on my phone. I can pass that around if you guys want. But it goes through the top one, the helmet fit. It actually goes through and it has different helmets that you can look at. So like a batter helmet, a bicycle helmet, equestrian, catcher, football, hockey, goalie. So there's several different ones: skateboard, skiing, snowboarding, and it actually tells you how, like, what you want to look for when you're trying to fit that helmet for that person. Because to me, I remember when my kid was bicycling age, and you go to the store, you go to Walmart, and you buy a bicycle helmet. I didn't know how you were supposed to fit it. You just put it on, you drop it. But there's actual, it's got to be this much from the eyebrow. They have to be able to see a certain spot. So it's pretty in-depth as far as finding the best helmet fit for your child, or for you as an adult even. It would be the same thing. And then there's brain injury basics. So pretty much everything that we've gone over today is kind of a little synopsis in here. So it kind of goes over those danger things to look for, danger signs that you're going to look for your kids. So that way if your kid hit their head, you can be like, okay, this is the stuff I'm going to be looking for. I just think it's a really cool app to be able to look at that. And then it talks about returning to school and returning to play for the kids as well, which actually goes for adults for returning to work too. So I just thought that was a really neat app. And it's free, so it doesn't cost anything, which you don't find. There's no in-app purchases or anything like that you don't find hardly anymore at all. So, all right. So pretty much the last part, I'm just going to be talking about the Heads Up program, which kind of is the CDC program that they've put together. There's actually another program called the Impact program, which is used by the medical community in some areas. It's very in-depth. It actually utilizes physical therapy, occupational therapy, speech therapy, medical providers, uses the athletic trainers, but the only problem with it is you have to have a baseline test done, which is very expensive to do because there's all this computer program that goes along with it. So in some of the bigger cities, they utilize this, and definitely for the NFL, they use it where they do baseline testing on the players. They see kind of where they're at mentally, cognitively, physically, and then that way when they get hit or they have a concussion, they can start testing them and seeing when they're getting back to baseline. That's when they know when they can send them back in. So we don't have that because it is so expensive. So mainly what the CDC is doing is this Heads Up program. So this is just kind of to kind of guide all of us as far as when to send them back to school, when to send them back into their physical activities. So, we used to be, like Ted and I were talking about this morning, it used to be like, can you see my fingers? Okay, you're good, go back in. So, we used to just send everybody back in, or, yep, okay, yep, you're good, go on, go in there and take another one for the team. We don't want to do that anymore because that's where that secondary impact comes in, and we end up with that cumulative trauma. So what we're saying now is, like, if somebody comes in with a concussion, I'm going to tell them go home and rest. I want you to be off. Usually I say a week because most of the time it's going to take that amount of time for a lot of those symptoms to kind of subside. They're going to end up with headaches. Even if it's not that night that they're having a headache, they're going to end up with headaches. They're going to be more fatigued. So what we're trying to do is to slowly put them back into any kind of activity. So even going back to school, us even going back to work. So going home, resting, very little time on the phone, very little time on a computer, very little screen time for the television. So it's even book reading is limited. So it's trying to rest those eyes, because every time the eyes have to take something in, the brain is working. I mean, it's just constantly going, so we need to rest that. Getting as much sleep as you can, taking naps during the day if you have to, so that you can get your energy level back up. When you start feeling less fatigued, stop having kind of those daily headaches, daily dizziness, whatever symptom it is that you have, then you can start moving on into light activity. And kids get very, 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 very frustrated with this because they want to be able to say, okay, I'm going back tomorrow. I'll be good, right? I'm going to go back tomorrow. No, I want you off for a week, and then I want you to follow up with your provider, and I want you to talk to them. And a lot of times the kids will lie that they don't have symptoms still. So it's definitely something that the parents need to be aware of, and they need to be listening and saying, okay, but you said you had a headache yesterday. So those are symptoms. So the brain's not ready yet. So light activity. So usually you can start doing kind of some activities that don't cause the symptoms that you've been having. So, headache, dizziness, fatigue are usually the major ones. So if they're not having those, they can slowly start going back to those activities that don't cause those symptoms. However, if they are doing an activity, say they go back to school, and which is kind of a bad one for kids because maybe they don't want to go back to school, but they go back to school and they start having some symptoms. So maybe they don't go to all-day school. Maybe they just go for a couple of hours. They come home and they rest. The next day they go to a couple of different hours. They come home and they rest. So it's just slowly moving them into what they can do. Maximizing their nighttime sleep, again, avoiding screen time, loud music, doing good sleep hygiene right before bed. So for everybody, good sleep hygiene is no caffeine after noon, which I don't ever follow. And then, you know, not utilizing your phones, anything that has the blue light. So no phones, no computers, at least 2 hours prior to bedtime. And then making sure that you're going to bed about the same time every night, that you're getting up about the same time every day, just kind of gets your body into that rhythm. So trying to kind of get the kids and us back into that after an injury is really a big thing too. Reducing daytime naps so that way they're more tired at night. Of course, if they're smaller kids and they're still supposed to be taking naps, you definitely want to do that. But if you're able to do that, then you can slowly, it's really just about slowly moving back into the activities that you normally would do. If any of those activities cause any of those symptoms that you had, stop. Back off, rest a couple more days, slowly try to start again. So it's not like you're going to be like, okay, you're good, go back to, go ahead and go back. So even at that week appointment, if the doc says, yeah, let's go ahead and try it, you're not having any symptoms, you've been symptom free for a couple of days, go ahead and try to go back. If the kid goes back and starts having symptoms again, it starts all over again. So we take them out, we rest them. I had a friend, she's a nurse practitioner up in Minnesota, and her son plays baseball for college. So this will be his third concussion. So this year he actually got hit in the head with the baseball. And he was out for almost a year with this. So it was last year that he got hit. So he was out for almost a year, had to miss a whole summer of baseball up there, which Minnesota doesn't have really long baseball times anyway. So it took him a long time. And of course, being in college, he still had to have his mom drive him around. He couldn't drive because they were worried about him having difficulty with that because he had to focus so much. So, I mean, it can be anywhere from a week to a long time. So he's finally back, and he's back playing now because he does also some traveling teams and stuff too. So he's back playing now. But I mean, it took almost a year for him to be able to go back because he would try to go back and start having the debilitating symptoms again. So they'd pull him back out. And I mean, it was just, I felt really sorry for him. He had a broken arm 2 years prior to that. I mean, he's just had one thing after another, but it just takes a long time sometimes for these things to resolve. So back to regular activity when you're able to do all of those things without any symptoms. So, and again, if they start happening again, the symptoms, you gotta step back again. So don't feel bad if you make your kids step out because you're saving them from long-term problems later on. So, and that I think is hard because as parents, I think sometimes we want to see our kids get out there and do well, and they love playing, and we want them to go, and you might get a scholarship, and that's great, but they might get a scholarship and they may not be able to go to college because they can't focus. So, we got to kind of weigh what's most important. And that's really all I have for you guys. My last comic for Johnny. And if the Gulf area of the brain was somehow destroyed, there might be a little something extra in it for you. So that's it. Yeah. Any questions about anything? It's kind of a touchy subject, especially when you're talking about kids. So it's hard, but.
That was a great presentation. It's too bad more parents weren't here.
Yeah.
Is it an old wives' tale that if a kid hits their head and there's a goose egg, pops out, that's good, a good sign? Or if you don't see anything and it's inside is a bad sign? Is there any truth?
No, none at all. Not at all.
That when my kids were little.
I was too.
If you see a goose egg, it's okay.
I was too.
Really?
My mom told me the exact same thing. Yep. And I'm like, no. So yeah, no, there isn't. It's just whether the blood vessels broke out here, causing that small bleeding or hematoma. It doesn't tell us anything about what's inside.
Would there be a possibility of offering this to the athletes at high school?
Sure, if they're interested.
Wasn't that
Yeah.
question one I had when I got hit?
Definitely.
It's easy to describe these concepts in a lot of words, but I'd like to just use one word: overstimulation. Have you ever heard that with kids? I mean, I know you mothers have. The brain has filters, and we can filter out what we need to filter out most of the time and concentrate, and focus, and do things. But when the brain is overstimulated, what happens? We can't do that. And then the person reacts, and kids, react much like brain injured individuals do behaviors. You start to see behaviors first. And it's literally that they can't cope with the amount of stimulation that they're getting. And so overstimulation is a word I like to use. Is when we do that, then we're retarding that healing process, essentially. So I have personally seen working at a brain injury unit where it was very quiet. Is the less noise that patient had to endure when they were trying to rest was much better for them to heal. And I don't think that can be undersold. And if you think about it, now they're saying the same thing for all these concussed people. So, I mean, I think you take that pretty reliable piece of information. So,
Are coaches, you think, more observant now, or are they better educated on what to look for?
They are, yes. And I think legally they have to be, because it's so, there's a lot of legality, a lot of suits out there. So I think they have to be legally. But yeah, I think it would behoove them to definitely follow the CDC guidelines. Yeah.
We'll have a meeting every year before the season starts, have all the coaches there.
Right. Right. Yeah. Yeah. Because it has changed a lot. I mean, it's changed. Well, I've been a nurse since '91, so I mean, it's changed just in that time frame. I mean, it's.
Well, and I think the NFL has led the way as far as I know, but the concussion protocol or whatever they're calling it now has not been around all that long.
No.
Right.
And,
Right.
And it's just now, I think, that as a society we're starting to care about this, and
yep.
we need to. More stuff like this needs to be out there.
Yeah.
And I really do think we do. And I'm glad you're doing this.
Thanks. Yeah.
Yeah,
Yeah.
thank you.
I think it's huge. So, yeah. Anything else? Okay. Thank you, guys.
Thank you.
I guess one thing I was going to say is if anybody has any requests for topics, Jesse and I are open to that. We're going to do, I think February 6th, we're going to do heart disease, focusing more on women because February is heart disease for women. So we're going to go over that. So talk about some things to look for and watch for and prevention for that too. So, yeah. All right. Thank you, guys.
Thank you.
Thank you.
Yeah.